Yeah, Susan. Madame Pritchard. Yeah. Est-ce que ça, c'est votre... Oui, c'est notre rapporteuse et sur cette chaise. C'est pour ça que je l'ai mis là sur le...
In April of 2001, Prime Minister Jean Chrétien created a commission on the future of healthcare in Canada in response to growing concerns from Canadians across the country. Since Medicare's inception in the 1960s, needs have changed, expectations are different, and technology has significantly evolved. The commission began by exploring different ways of gathering information.
When Mr. Romano was appointed commissioner and the commission was set up last spring, he was pondering, basically, how can we do better? Or how can we do a true dialogue with citizens? Or how can we get good input from citizens?
En apparence, il s'agit d'un exercice comme les autres, dans lequel on demande à des gens un exercice délibératif comme les autres, comme il s'en fait beaucoup dans le monde à l'heure actuelle. Les gens participent à des exercices de discussion, puis au terme de la journée, produisent ou ne produisent pas un consensus autour d'un certain nombre de questions qu'on leur a posées au départ. Mais dans les faits, ce qui nous intéressait, nous, c'est de comprendre pourquoi les gens changent d'avis, comment les gens forment leur opinion, comment les gens définissent leurs projets, comment les gens se définissent par rapport aux projets des autres dans un exercice de discussion lorsqu'ils sont face à un certain nombre d'informations. Et c'est cette particularité qui fait de la méthodologie qui a été suivie dans ce dialogue quelque chose de tout à fait unique, à la fois dans l'histoire des commissions royales au Canada, mais aussi probablement, si on le compare à cause de l'amplitude de la consultation, à ce qui s'est fait ailleurs dans des exercices délibératifs.
While in the planning stages of the project, the Commission looked for organizations that had some experience in the field of choice work dialogue. It partnered with Canadian Policy Research Networks, a think tank, and Viewpoint Learning, a company founded by public opinion polling innovator Daniel Yankelovich and Stephen Rosell.
Viewpoint Learning is a new company that Dan Yankelovich and I put together 2 or 3 years ago to do a number of different things involving dialogue. And in the particular case we're talking about here of choice work dialogues, it has to do with moving beyond what polls and focus groups can do to find out what people believe if they have a chance to actually think about it, talk about it with other people like themselves, which is the way in which opinions really are formed, is by people talking to each other. They don't do it analytically, they don't do it by listening to experts, they do it by talking to people like themselves, people they respect, and comparing life experiences.
We knew that we wanted to conduct a national project. So we knew we had to hold sessions, and we had held 12. We knew we had to hold them across the country. We were also looking for the possibility of being able to analyze regional differences if we saw them. And for that reason, we sort of had to have three sessions in each of the 4 regions.
The participants work with a manual that contains background information on healthcare, including the 5 principles of the Canada Health Act, which ensures a publicly funded system for doctor and hospital services and equal access for everyone across the country. It also includes 4 values-based choices of different options open to Canadians as a starting point for their dialogue.
Donc, on vous propose 4 scénarios de départ pour le dialogue. Puis vous allez voir que tout votre petit livret, là, si vous avez eu le temps de le regarder, il y a pas mal de données pour vous expliquer chacun des scénarios. Un scénario, c'est d'accroître les investissements publics. Ça veut dire ajouter des ressources. Ça veut dire, en gros, soit augmenter des taxes, augmenter les impôts, ou de prendre l'argent de certaines autres priorités puis de les transférer à santé pour avoir plus de ressources. Puis ça serait simplement pour maintenir ce qu'on a maintenant compte tenu du vieillissement de la population puis de l'augmentation de la population. Ça, c'est une perspective.
The second approach, which is advocated by some,
is called Here, Share the Costs and Responsibilities. And what it says is, yes, we do need to add more resources to deal with current problems, but we shouldn't do that by increasing public spending, but rather use a system of user co-payments for healthcare services. And the idea there is that it would provide funding for the system, but also it would provide an incentive for people not to overuse the system if they have to spend something in order to use the healthcare system.
Une autre possibilité ou un autre scénario, c'est laisser aux Canadiens le choix de se faire soigner par des prestataires de soins privés. Donc, il y aurait le système public, puis parallèlement à ça, il y aurait des cliniques privées ou à but non lucratif qui permettraient de décharger le système public et les gens pourraient assumer leur service. Si on voulait avoir un service plus rapide, on pourrait aller dans une clinique privée, soit le payer nous-mêmes ou le payer à même une assurance privée. Puis ça ferait en sorte que, encore là, ça déchargerait et puis ça pourrait aller plus vite.
And the fourth choice is called Reorganize Service Delivery. And that one talks about reorganizing service delivery in order to provide more integrated care, to realize efficiencies, and expand coverage. And under this scenario, each Canadian signs up with a healthcare provider network who would work as a team to provide more coordinated, cost-effective services and improved access to care. That, in other words, is the notion that you sign up with a group of multidisciplinary providers, different healthcare providers who are part of this network. You sign up with the network, and they provide you as a team with those services. But you basically get those services from that network. And what we found is that it's one way that you can really get people to grasp very quickly an awful lot of very complicated information is not to present it as a data dump or as an analytic paper or an expert paper, but to have several different stories or scenarios of what we could do and what the pros and cons are of doing it. And they really internalize that very quickly, as we've seen, and have extremely sophisticated conversations about what the implications of that are for themselves and for others and what difference that makes. What we're trying to get to in the dialogues is to get a better and deeper understanding of what citizens' values are, what their views are, what they see as important, what changes and trade-offs they're prepared to support to improve the healthcare system in Canada. So the choices are designed really to surface that. So the final solution will always be a mix and a match of those because they're pure choices.
The participants are shown 4 wall charts, each one giving another piece of the puzzle. The first one illustrates the downturn of Canadian satisfaction towards their healthcare system, going from 61% to 29% in 10 years. The second chart indicates the rising cost of healthcare, projected to be over $3,000 per capita by 2020. The third shows the growth from 1980 to the year 2000 of public and private monies combined being spent on doctors, other professionals, and drugs. It highlights the fact that more money is spent on drugs than any other category. The fourth chart ranks Canada internationally. Canada is relatively healthy, ranking 5th, but pays quite heavily, ranking 4th in terms of costs. All the information given is not to make citizens into experts, but to give them enough information to have a proper dialogue.
The information was good background information, and it was useful, and I wouldn't want to not had it. But having said that, it wasn't sort of an everyday tool that we used sort of every minute. It was a good base.
Les arguments pour et les arguments contre qu'on avait dans le document, ça aidait. Mais je crois qu'avec le vécu personnel de chaque participant, on a assez de bagages. On n'avait même pas besoin de ça.
At times, though, maybe it was too limiting because people thought that this is the way it should be, and it's either this, 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 or this. But I did like how, at the beginning of the discussion, the 2 women directing it, facilitators, opened it up and said, these are ideas. We can open up to anything. It can be anything's on the table, so please don't feel limited to just to these 4 scenarios. So I thought that was good that was reinforced.
Puis tout ce qu'on avait dans le petit livre, les statistiques, puis tout ça, je savais rien de ça, c'est que j'ai appris comme des tonnes de choses aujourd'hui.
We then asked them to fill in a very quick questionnaire, which basically is to measure what their point of view is as they arrive, and it's something we use to measure the before and after changes quantitatively. Then everybody gets a chance to say something that's on their mind. It gives everybody in the room a chance to say who's here, where are they coming from, where are they starting from. It gives everybody also a chance to warm up, that they're part of the process.
All we'd like to know is, in about 30 seconds,
your name, and then one thing, either an experience or an issue about healthcare that concerns you or about which you feel strongly.
My name is Anita. Until about 2 years ago, my health had been slowly degrading for 15 years, and regular doctors, were unable to help me. My health has improved 2,000% in the last 2 years based entirely on alternative, so-called alternative healthcare. So I would like to see a much closer integration between regular health care and alternative health care.
Bonjour, mon nom est Michel Robert, je viens de Chicoutimi. Ma préoccupation la plus grande, je pense, c'est un peu comme souvent, puis on va tout sortir, c'est au niveau de l'accessibilité. Que ce soit égal pour tous, qu'on soit faible ou à haut revenu, puis qu'on soit en région éloignée ou qu'on demeure dans les grandes villes, qu'on ait les mêmes services partout égal à travers le Canada.
My name is JC, and I'd like to see to emphasize more healthcare into education, and to see a stop of people to stop to abuse the medical system.
My name is Liliana Bertolotti. I was born in Italy and grew up in England. I've been in Canada since 1976, so I've sort of taken universality for granted. I'd like to keep that up, but I am concerned about what I perceive as the indiscriminate use of drugs.
Bonjour, je m'appelle Marie Roy, je viens de Québec. La raison pour laquelle je suis ici, c'est pas une préoccupation, c'est plutôt moi j'ai peur de tomber malade, gravement malade et de ne pas recevoir les soins ou d'être mise sur une liste d'attente. C'est ce qui me préoccupe. Non, ça me préoccupe pas, ça me fait très très peur. Merci.
Hi, my name is Jaswin Rathore. I am a new immigrant in Canada. My basic concern is, can we sustain with this rising cost of a new healthcare system or not?
Hi, I'm Glenda Hill. I came here from Toronto to take care of my grandmother and parents, concerned about the home care service that is happening now.
Hi, my name's Robert Erickson. My concern is I see the issue as a balance between death and taxes. Let's not tax ourselves to death, but let's do what we can to improve the quality of our lives.
Moi, je m'appelle Félix Fonseca, je viens de Québec, de la ville de Sainte-Foy, qui n'est plus une ville d'ailleurs. En matière de santé, moi, je pense que ce qu'il faudrait que les générations d'avant réfléchissent sur cette question, c'est qu'il ne faudrait pas que les futures générations n'aient pas les mêmes systèmes de santé que leurs parents, eux, leur avaient donné. C'est-à-dire qu'ils nous donnent les mêmes systèmes de santé pour que nous aussi, on puisse garder le même système de santé pour nos enfants qui viendront.
People themselves kept coming over to me. I know several of the dialogues, and they asked, well, how were we selected? And I would say, well, you were selected at random from the phone book. And at first, they wouldn't believe that. And the reason I think they wouldn't believe that is because that's not the image of themselves they get in the media. The image of themselves is people can't really deal with this stuff. You've got to leave it to the experts. But what they were seeing is they were very much able to deal with these issues, these values-based questions. I think we systematically underestimate how much of a contribution ordinary citizens can make, given the right kind of process and given basic information organized in ways that are designed for them to be able to use.
We wanted the participants in the session to be roughly 50% women, roughly 50% men. We wanted our group to mirror Canadians when it comes to education levels, when it comes to income categories, and when it comes to age. We did okay, but our results weren't perfect.
In the meetings after the initial presentations, the 40 citizens are broken up into groups of around 10 people. The groups are asked to answer this question: what kind of healthcare system do you want to see in 10 years?
When you get a group, you usually have some people who sit quietly and they seem afraid to speak out or, interrupt and say, excuse me this or whatever. We didn't seem to have that, at least at our table.
À partir de ça, là, on allait chercher les idées des gens. Puis là, on se rendait compte qu'il y avait beaucoup trop d'idées. C'était difficile de mettre ça en commun. Donc, on a fait un tour de table. Et après avoir fait le tour de table, on s'est rendu compte que finalement, nos idées n'étaient pas si différentes.
In our small group, we had enough people that were very opposite. I don't know if the other groups were quite as divided as our group, but we were very divided, and it was really hard to get to the small things.
Un gros groupe, t'as 40 secondes pour parler, ou 25 secondes, ou 30 secondes, comme un matin, ou une minute. Tandis qu'un petit groupe, t'as 1 heure, t'es 10, ça te donne, si tu calcules ça, 6 minutes pour parler. Ça te donne un petit peu plus de temps pour émettre au moins ton opinion. Si tu en as une, si tu n'as pas, mais ça te donne la chance peut-être à d'autres d'émettre, mais toi, ça te donne la chance d'écouter un peu plus, puis t'en faire une opinion en écoutant les autres.
I felt I had a chance to speak and voice my opinion, but there were at least 3 people at our table that probably spoke once in both of the 2 sessions.
Getting into the smaller groups, and then people's personalities start to come out, and you had to keep reminding yourself that it wasn't debate, it was dialogue, and to listen.
We placed a great deal of emphasis on this being. This was not a debate, and we weren't driving to a set of right or wrong answers. This was really to be a dialogue among citizens.
So when we're talking about debate, which is not what we want to be doing today, there's an assumption that there's one right answer, there is one truth, and you've got it.
The dialogue process is one that is designed to find common ground, to have conversation in which people can learn from each other.
People at the beginning are briefed on what a dialogue is and how it's different from debate. And the short version is that a dialogue is about learning and understanding. It's not about getting your point of view to triumph. You can't win a dialogue. And if you think about it, that says it all.
And see what emerges from that process.
Debate's about winning, dialogue's about finding common ground.
In a debate kind of process, there's a basic assumption being made. We assume that there is a right answer.
As opposed to, in dialogue, listening for understanding.
I think everyone likes to think that their idea is the right one. And I think that helped just to remember that it wasn't like a shouting match or I've got the better opinion. It was open to debate or to dialogue, and that we weren't trying to come up with the right answer. I found that helpful personally.
Les gens ont vraiment dialogué. Il n'y a personne dans mon comité que j'ai animé durant l'avant-midi qui a essayé de faire valoir son point de vue sans tenir compte de celui des autres. Et rapidement, après quelques minutes, on s'est rendu compte qu'il y avait un consensus sur certains points qui étaient unanimes.
I think that if they hadn't put those, that page of, where it described in a debate what you do and in a dialogue what you do, and a couple of times the facilitator reminded us, wait a minute now, this isn't debate, because it would be easy to go off the track, get into a debate, and waste a lot of time on, whereas with the dialogue, there was more time to listen to other people.
J'avais peur avant d'aller là. Je dis tout le monde va chicaner parce que j'avais vu des fois à la télévision comme du monde qui chicanait sur des débats politiques. J'ai dit je veux pas aller me chicaner, j'aimerais juste comme pouvoir apprendre des choses puis dire mes idées. Puis finalement dans notre petit groupe à nous autres, on s'est pas chicané, c'est juste tout le monde respectait tout le monde puis c'était vraiment bien.
And I have to say I was really glad for the outline on dialogue versus debate, really outlining the differences between the two. But then after we sort of finished the morning session, I was kind of disappointed with how little headway our group was making. And if I go back and reflect on what some of the differences between dialogue and debate are, I think we as a group needed to go over some of those points a little better.
And then the groups come back into a plenary, and each group reports and says, this is what we've come up with. And usually they're quite surprised to see that each of the groups have come up with a lot of things in common and a few things that are different.
C'est pas de créer des nouveaux systèmes, c'est de mieux informer les gens que ces systèmes-là existent, parce qu'ils sont là.
Un dernier point là, où on se disait il ne faut absolument pas que ça bouge, on ne veut pas que ça coûte plus cher. Donc on veut que le système reste équitable et universel. On a fait une distinction entre les deux à cause des personnes et des régions.
And then we talk it through in the full group and come up with a shared sense of what's our common ground. What do we all agree we want to see in our healthcare system 10 years from now? And that sets sort of a benchmark that we can work from then on.
I think my favorite part was listening to what the other groups had to say when they were presenting sort of their general consensus ideas and thoughts.
Certainly the ideas came out and I was really pleased that we were able to hear other ideas than just our group, because that did, I think, validate some of what I was feeling and maybe I hadn't put into words in the morning session just because I either hadn't thought of it or wasn't comfortable voicing that. So.
C'est pas une différence, encore une similitude, mais je pense que j'ai juste un autre point que je voulais peut-être dire, c'est au niveau de la responsabilité des infirmières puis des personnes en dessous des médecins, on pourrait peut-être leur donner un peu plus de responsabilité au niveau des prescriptions, des affaires comme ça. Ça l'aiderait peut-être au niveau de l'engagement aussi des hôpitaux.
Donc, c'est quelque chose qui est ressorti dans d'autres groupes ce matin, ça?
Oui, je pense, nous autres, en tout cas, tout le monde a parlé de ça, puis je pense que c'est un point important à noter aussi.
Donc, c'est de responsabiliser plus les autres partenaires.
Je sais qu'ils commencent déjà à l'université, dans les cours d'université, les infirmières vont avoir le droit de faire des prescriptions, mais ça pourrait être davantage à ça.
OK. Oui?
Typiquement spécialisé aux pathologies rurales, c'est-à-dire aux problèmes qui se passent dans les campagnes. Mais moi, je me demande, est-ce que ça ne causerait pas un problème d'équité par rapport aux villes et à la ruralité? Peut-être que la personne explique mieux sa question, son point de vue.
C'est la réponse à ça?
Nous autres, on en a parlé aussi. C'est pas une question de cause à effet, c'est une question de se dire, si on veut que le système soit équitable et universel, il faudrait que les gouvernements provinciaux, par exemple, injectent plus d'argent en région.
Well, a typical consultation would be that the Commission would publish a position paper or an interim report, and then would travel across the country and hold town hall meetings. And the public would be invited to come. Sometimes it would be only specific people that would be invited. Sometimes it would be actually an open public meeting. And, there'd be a few hundred people in the room.
What your polls usually measure is just a snapshot. You ask somebody a set of questions over 10 or 15 minutes. They tell you, the usual phrase is, people give you an answer whether or not they've ever thought about it before. And so that's what you're measuring, and that's why, for example, in a poll, if you change the wording slightly, you can get quite different answers. In this case, what you do is you actually find an opportunity for people to work it through with each other over a period of time. And that gives you a much more stable result. You know really not only where people are off the top of their heads, but where do they get to when they actually work it out.
Au coût de la vie, il faudrait discuter dans vos groupes cet après-midi. Vous êtes prêts à vivre avec quoi? Si vous assumez ayant tout réglé les questions d'efficacité, en assumant que c'est bien important pour vous, puis qu'il y a une bonne gestion, puis qu'il y a des mécanismes pour vous donner, vous dire un peu, vous sachiez où est-ce que c'est rendu, comment on fait pour assurer que le système va pouvoir se payer? Point de vérification, encore là, dans la gestion. Information, éducation. Il y a information, éducation, prévention, ça revenait souvent. Sensibiliser les médecins, les infirmières, sensibiliser les médecins, puis traiter la cause, donc une approche beaucoup plus globale. Responsabiliser les infirmières et les autres qui travaillent avec les médecins. Côté humanitaire, ça revient encore, et voilà. Donc ça représente ce que vous, collectivement, vous avez dit que vous voudriez avoir comme caractéristique d'un système de santé. Il y a des différences où vous aurez à essayer de voir, surtout au Québec, par exemple, si la carte à puce s'en vient de toute façon, ça vous donne l'occasion de voir quelles sont tant les possibilités que les limites et de vous positionner par rapport à ça. On n'est pas certain encore, système public-privé, si on veut avoir tout ça, qu'est-ce qui devrait être les acteurs, quels devraient être les mécanismes pour s'assurer que ça va bien, puis qu'on puisse continuer à avoir une idée de comment ça se gère. Alors, ce qu'on va vous demander de faire cet après-midi, en fait, c'est de partir de votre avenir souhaitable et de dire, bon, ben là, il faudrait mettre quoi en place pour que cet avenir souhaitable-là se réalise. Commencer à décrire, puis en fait raconter l'histoire, peindre le portrait.
Facilitator is there really to enable the citizens to work the stuff through. So they're there to make the initial presentations, to set the scene, to form the groups, to be available to the citizens in the groups if questions come up either about the substance or about the process, to keep people on time, to push the questions in the plenary so that we're sure that we're getting the answers that we're looking for. But otherwise to stay in the background so that in the groups it's the citizens who chair them, and that you trade off something there. They may not be the best chairs, but they're the authentic chairs. I mean, and what you get is really an authentic voice coming back. If you have facilitators chair it, there's always a suspicion, and in my experience, a valid suspicion, that what you're getting has as much to do with facilitators as it has to do with the citizens who are actually in the group.
The citizens once again go off into their same small groups, now with the challenge of coming up with a plan of how to build their ideal healthcare system.
moi, ce que j'ai trouvé, c'est qu'on était fatigués l'après-midi d'avoir fait ça tout d'un bout, de ne pas avoir pris le temps de relaxer un peu. Puis les gens parlaient beaucoup, s'astinaient plus, puis il y avait beaucoup de bruit dans la salle. C'était comme plus difficile là, de suivre le fil de la conversation, moi, j'ai trouvé.
I was interested all the time. I paid attention right through what everybody had to say. After lunch at a meeting like that, it's not hard to snooze or to doze off, and I didn't find any, when you go to a lecture, sometimes it's hard to stay awake at the end of the day, after lunch, and so it kept my attention right through. I was interested.
The ideas that came out of the large group sessions, I think, was exciting, and it was also exciting to feel the tension that some of those ideas created, because you could hear people making sounds that clearly expressed disagreement, and there were people going, "Yeah, right on."
C'est plus on est nombreux dans un comité, on était au-dessus de 40 personnes, plus le risque de diluer la position sur certains points est grande, dans le sens qu'à force de faire des compromis, de mettre plusieurs côtés positifs à un point, plusieurs côtés positifs, finalement, ça donne des fois un résultat mitigé là, qui se trouve être au centre.
The next session, the afternoon session, is the hard one, which is, okay, how do we get there? And what kind of trade-offs and choices are we prepared to make to get there? Because you can't have it all. There are always things that you have to trade off to make it affordable, to make it feasible. And then they work together in the same groups in the afternoon, again in a dialogue format. But now the question is, given that this is where we want to get to, this ideal future we described this morning, what actual steps can we take to get there? Then again, the groups come back, they report on what they've done, and then we do the hard work of trying to work through a set of steps that we can take to get to the healthcare system we want, that's affordable, that's consistent, that works together as a set. And that's where the most interesting conversation I find happens when people really make difficult choices, really try to get past the wishful thinking and the denial that we usually start with, and actually come to some sort of understanding of what we can do together to improve the healthcare system.
You can't pay to get faster cancer treatment, or you can't pay to have a baby. So that's the reality now, and the question we're asking you is, should people be able to buy private health insurance for these services, including these, or should this line be, do you want this line to go above and have everything covered by the public health care system? That's the question. Yeah. Now, if you want everything to be covered by the public health system, then you get into how do we pay for it?
Having a two-tier system makes a basic assumption. If we have a two-tier system, where we allow private access, that means that we have accepted that we can't fix the public system. It can't be fixed, so therefore the only solution is to allow a two-tier system. And that's fine if that's what we want to say. But I think the other reality is that if we accept that, it also means that we're also accepting that not only is the public system cannot be fixed, it's also going to continue to degrade. And we're accepting that.
Okay. No, I've been called a bleeding heart before, so I don't care if you call me that again, but it breaks my heart when I see one of my students with her cheek sticking out halfway out of her face because she's got a huge abscess and her parents can't take her to the dentist. And I see another one of my students who has to practically sit on the chalkboard ledge in order to be able to copy anything off the board. I would like to see eyeglasses and dental care, as they are necessities, not luxuries. I would like to see those included, at least for those people who have no other possibilities.
And you're talking about the public health, not under private insurance, but under Medicare.
Right.
Well, looking at the list that you have there right now, to get private clinics to be able to do hip replacement, for example, it takes a long time to become a surgeon, an orthopedic surgeon, to be able to do hip replacements. We don't have enough in this country as it is right now, graduated with the experience to be able to do it. Those who get the experience level are leaving. If we're going to open up private clinics, now you have a demand on both public and private to have the same specialists fill those roles. We don't have the personnel to do that. So unless you're going to tell me that a private clinic, a private company is going to start funding the education level to be able to create the doctors that are needed to be able to fill their roles without stealing it away from the public system, then I don't think they should be operating.
And what if having those, though, attracted doctors from outside of the country into the country?
That's a good point in that, but as long as it's proven that it can do that, that we don't put ourselves at risk of lowering the bar for the people who do need it in the public system. Okay. Because otherwise, the private sector is the private sector, and it's going to work like anything else, that if I can offer more money because I'm going to generate more money to get more people through the door, I'm going to steal all the graduates who've completed the requirements for to be able to do MIR scans and CAT scans, because I'm going to pay them more than the government will.
It seems like the way I'm reading it is that some people are willing to pay more of their own money to have better health care for themselves in a two-tier system, and other people are willing to pay more taxes so we can all have a better health care system.
Hear, hear. Yes. Right.
I didn't hear that at all. I don't know why they'd be mutually exclusive. I mean, isn't the same person prepared to pay more taxes perhaps and go to a independent private clinic? I never heard that the persons who were proposing the private insurance option were refusing to pay their tax bills.
I think that the lady at the end is perfectly correct. The implicit assumption is that by having a private healthcare system, it enables the rich to pay for their own medicine and thereby unburden the public system, and thereby preventing a tax increase.
Then at the end, we ask them to, again, fill out a new questionnaire, similar to the one in the morning, which gives us a sense of how their views have changed in the course of the day. And then everybody gets a chance to have a last word, to talk about what they've learned in the course of the day, how their views have changed, and one kind of message they'd most like to give, in this case, to the commissioner, to decision makers, about healthcare in Canada.
My views haven't changed since this morning. It's still the same. I'm glad that a lot of people that I have met here share the same views. And as far as for the decision makers, I just like to let them know that I believe, as a Canadian, that the healthcare system is not just something that, a service that we use. I think it's more like an institution, and that's what defines us. If we don't have that, we could lose a lot of our identity and what we are and what we see the world.
Bon, mais tout le monde dit tout le monde. Ben moi aussi, je dis tout le monde est conscient du problème. Et puis tout le monde, ben c'est pas juste nous autres ici, c'est tout le Canada au complet. Puis ben les points qui sont sortis, ben il y en a déjà qui sont déjà en branle, la prévention, la publicité, etc. C'est sûr que qu'est-ce qu'il y a à faire, ben il y a eu ça aujourd'hui qui était fait, qui est de nous écouter, de ce que l'on a à dire. Et puis, ben, la journée d'aujourd'hui m'a apporté que ma santé me préoccupe encore plus maintenant.
I've learned today the number of differences people have, and how concerned everyone is about our health care, and how Medicare should be administered. Some sort of marriage between private and public care, assuring that the Health Care Act is not compromised, and that, yes, I have changed my opinion today.
I came here feeling good about our health system. I leave here feeling good about the consensus amongst the group. And my message is, forget privatization, forget the premiers, and listen to the citizens.
Oh, ben alors, comme tout le monde, moi j'ai bien aimé ma journée. Je trouve que c'est de quoi qu'on devrait avoir plus souvent, parce que faut pas oublier que le gouvernement sont là pour nous représenter, nous autres. Donc, justement, la communication, c'est très important. Je pense que si on avait plus de journées comme ça, peut-être que le gouvernement saurait plus c'est quoi les besoins du peuple comme tel au Canada. Aussi, ben, c'est sûr que, comme monsieur a mentionné, je me suis rendu compte que je ne suis pas le seul à avoir peut-être un manque de confiance en le gouvernement aujourd'hui. C'est sûr que vous avez aussi une part à faire au niveau de regagner peut-être notre confiance un peu, nous prouver que vous êtes capable de faire de quoi, comme porter un changement. C'est sûr qu'on a toute notre part à faire aussi, parce que la santé, c'est pas juste le gouvernement qui peut nous la donner. C'est sûr que, je sais pas si je suis pas le seul à faire ça. Moi, l'été, je me promène en vélo, j'essaie de faire des choses qui sont pas juste bons pour moi, mais qui sont bons pour la planète, n'importe quoi, parce qu'on a toute notre part à faire, autant que le gouvernement, il faut qu'il fasse leur part aussi. Merci.
Well, my views are still the same, but I found the day very interesting, and I was quite happy to see that a lot of people thought the same as I did.
Aujourd'hui, j'ai pris une chose pour dire tout le monde travaille ensemble. Si on travaille ensemble, peut-être on peut changer quelque chose. L'autre chose, notre système, c'est vieux un peu. C'est comme un vieux char. On a besoin de mettre la date, donner la peinture, changer de l'huile. C'est tant à faire. Et la seule chose que je veux, ça passe pour la commission, comme la madame a dit, mettez-les pas sur l'étagère. Nous, des personnes ici, à Québec ou en restant au Canada, on donne les points de vue. Prends-les et mets-les en marche. Fais marcher notre vieux char comme il faut. Merci.
My biggest shock / insight is that, yes, I am willing to pay more taxes. Really, truly, I didn't know a lot about the idea of team care facilities and the idea of team doctors and nurses and physio and all those. And I'm really believing that that is a very probable idea, very credible idea. My one thing that I would like to suggest is please look into the idea of having public health nurses in schools, in community centers, so that we can catch problems earlier and help those people who perhaps don't know where to go for the help and don't necessarily have the facilities to get where they need to be with their children.
Alors moi aussi, j'ai passé une très belle journée. Oui, je repars avec des plus. Il y a des informations que je suis allée chercher que je ne possédais pas. Je pense entre autres la répartition des coûts, ce que ça coûte pour le privé, ce que le particulier paie. En tout cas, je pars avec beaucoup plus d'informations. Je me sens privilégiée d'avoir participé à ce type d'exercice-là. Je suis très heureuse. Mon souhait serait que les propositions qu'on a faites deviennent très inspirantes pour la commission et puis que ça aboutisse à des réalisations concrètes. Merci beaucoup.
I've been really encouraged by how, as a group of 40 people here, that everybody is so caring about society. I don't think there are many countries in the world where you'd get a random sample of people and everybody actually that caring about everybody in society in the way that this group is. So that most people are actually willing to pay more out of their own pocket for healthcare for everybody is quite exciting. My views haven't changed much over the day. I was open-minded about the idea of use of fee. Now I'm against it. I don't think it's a good idea. But I think the main thing that needs to be looked at is prevention. I'm still really strongly on that. And that probably that needs to be done with education and teaching in the schools so that the kids come in with a strong basis of how to look after themselves well in their health so that they've got all the strategies that they need and they know about diet and stuff like that because certainly the lifestyle is causing a lot of health problems, I think.
Ce que j'ai trouvé de plus capoté aussi aujourd'hui, c'est que je pense que tout le monde pense la même affaire. Toutes les tirs se sont dirigés vers la même chose, la gestion puis la gestion. Je pense que c'est un message très important au gouvernement. Là, on parle de la santé, mais quand on parle de la gestion d'un bon gouvernement, bien, ça va être pas juste la santé. Je pense que le rapport de la commission va être pas mal plus pesant s'ils en tiennent compte que juste la santé. Parce que c'est, comme la dame me parlait à côté de moi, si t'as pas la santé, là, même si on donnerait de l'argent dans les arts et les cultures, si je suis malade et je suis sur mon lit d'hôpital, je serais pas capable d'aller voir les feux d'artifice à la ronde. Fait que ça me donne pas grand-chose de donner 500 000 $ par année là. Je pense que l'important, là, ça va être de mettre nos priorités à bonne place.
The results were analyzed by experts from the Commission, CPRN, and Viewpoint Learning. They used notes taken in the sessions, the questionnaires, and the videotapes of the meetings to formulate their report for Commissioner Romano. Part of the report includes what Canadians would like to see for their healthcare system and how they would be willing to pay for it.
The team approach mixed with the more public investment with a little bit of the co-payment. So it's a kind of a synthesis. But apart from that, I think it is the revelation is the degree to which people are now bringing their economic and their political values into the social policy mix. This is a very sophisticated, well-informed, and totally engaged public. Canadians have grown up a lot in the last 20 years. They've lived through some very hard times. They feel that their healthcare system is at risk. They're extremely proud of it, and they want to preserve it for future generations.
Une partie de l'information que nous récoltons à travers ce processus-là, c'est aussi une information sur la façon dont il faut parler, la façon dont il faut expliquer les choses, dont il faut mettre en valeur ou en forme les solutions qui sont proposées, de façon de répondre aux questions que les gens se posent vraiment. Je pense qu'un des résultats les plus fondamentaux pour moi de cette consultation, c'est le fait qu'on ait appris que les gens au Canada ne pensaient pas exactement comme les gouvernements, ne pensaient pas exactement comme les experts, ne pensaient pas exactement comme les professionnels de la santé lorsqu'ils avaient à se poser les questions qu'on leur posait. Et j'espère, c'est l'espoir de la Commission, c'est d'arriver à avoir un meilleur ajustement entre les solutions qui sont proposées et cette sensibilité particulière qui est celle du public.
I expected, for example, there'd be a lot of differences across the country in what people would say. And what was astonishing were the similarities. Very often you couldn't tell where you were by what was being said. You could tell where you were by other things. But the fundamental issues, the fundamental values, people started at different places at the beginning of the dialogues, but by the time they'd worked it through and come to what their conclusions were, the similarities across the country were quite striking. And that, for me, was, in a sense, reassuring. I've been saying, and other people have been saying that, you know, in an age of globalization and so on, where economic boundaries don't make nearly as much difference as they used to, the question of whether there is a Canada and what Canada is about has an awful lot to do with values. And what we saw a very clear expression of was a very distinctive set of values.
"12 meetings and 480 Canadians later, this unique and innovative methodology has been applied, and the months of planning, executing, and analyzing are over. But the question remains, was it successful?"
I came to this with a fair amount of skepticism myself about what it was that we were really doing and what it was we were really going to accomplish that would be different than a set of focus groups or different than conducting a public opinion poll. I'm now personally convinced that there really is something to this methodology.
This was the first time that we've done a truly national scale dialogue with enough people in enough places to be able to really demonstrate that we are speaking for all Canadians here. The earlier work has been very useful and we've learned a great deal from it, but it's also been very experimental. I think we've gone now from experiment to a genuine, substantive piece of research that can contribute greatly to the dialogue.
All in all, I think it was a productive process for sure. At the very least, everyone hearing different perspectives on similar issues.
Les gens se sont réchauffés et les gens vont parler plus fort de leur côté, que ce soit au niveau de leurs emplois, au niveau de quand les gens qui sont ici, la prochaine fois qu'ils vont aller voir le médecin, ils lui parleront pas de la même façon, ils exigeront pas les mêmes choses de ce médecin-là. Alors, ça a eu un impact énorme.
Oh yes, it was a great experience. Like, I mean, if I were 20, I could say that, and you'd say, yeah, but you haven't lived. I'm 62, and this is a day I won't forget.
It was just very interesting. I came here with different ideas than what I'm going away with, which is, I guess, what it's all about from a personal perspective. And then I think I added quite a bit to what everybody else had to say. So it was a good day.
C'est une très bonne idée, mais j'espère qu'il y a du monde à l'autre bout qui vont écouter. C'est beau de dialoguer, c'est beau de dire un paquet de phrases, c'est beau de dire un paquet d'affaires, mais si tu dis un paquet d'affaires, tu es tout seul dans une salle, puis tu dis un paquet d'affaires, il n'y a pas grand monde qui t'a écouté. Tu sais, ça ne donne rien.
I think it's a unique opportunity to get involved with something that, I mean, realistically we could have impact on. I mean, I don't want to say this is going to change the future of healthcare, but at least the premise is that you're going to be involved in this process and that you are going to make a difference. And I think if nothing else, most of us would walk away saying, well, I was involved, I had my 2 bits.
J'ai vu d'autres façons de voir en connaissant les autres personnes, puis ça l'a... Maintenant, il y a plus de... Mes valeurs ont changé un peu. C'est comme j'ai vu que des problèmes que moi j'ai pas, il y en a du monde qui ont ces problèmes-là, puis c'est comme je les vois plus maintenant.
I'm very happy that I came because I really wanted to be a part of this kind of process. I'm thankful we have the opportunity to do this kind of thing. I think sometimes, I mean, if we look at other countries, they can't even be thinking about stuff like this because they're starving and they don't even have health care to debate. For us, it's a real luxury to even be at this level of being able to have these kinds of discussions.
Mostly, though, what comforts me the most is how everybody feels that same warmth, that same caring, that passion for it. You don't feel that you'll be alone. If you need help, there'll be all those millions of Canadians there. It almost makes me cry because it's so, it was really